I'm Dr. Gaurav Sharma from Dehradun at Care Clinic and Graphic Era Hospital. Today, I'll be talking about the latest updates in hypertension. As most of you would be knowing that hypertension is a non-communicable disease and 63% of total deaths in India is due to non-communicable diseases, and out of which 27% are because of cardiovascular disease, which affects almost 40% people between the age groups of 40 to 670. Raised blood pressure is among the most important risk factors for cardiovascular disease. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow up. A lot of people do not know that they are hypertensive because there is most of the officers do not have a blood pressure monitor, and most of the people do not have a blood pressure apparatus. In India, the prevalence has also gone up above over 30 years to 38% in men and 32% in women, from 29% and 28% respectively. Despite that, nearly half of the people, or 51% of the men and 41% of women with hypertension, are unaware of the condition. International Society of Hypertension has released the ISH 2020 Global Hypertension Practical Guidelines. Inclusion of optimal and essential treatment paradigms attempts to address the issue that the resources are in poor settings. Optimal care refers to evidence based standard of care, whereas essential standards refer to minimum standards of care to allow specifications of essential standards of care for low resource settings. The American College of Cardiology had released a scientific statement in 2021 offering new guidelines of management of stage 1 hypertension, among which the low ASCVD risk among the adults of 10 years mortality, in which the stage 1 hypertension, the blood pressure between 130 to 139 and diastolic pressure of 80 to 89. Management starts with non-pharmacological therapy, that is lifestyle modification. And acute respiratory distress syndrome is potentially fatal condition involving lung damage and exerts often associated with severe COVID-19. A recent study which appears in the Journal of American College of Cardiology said that the metoprolol can reduce lung inflammation and improve respiratory function in people with COVID-19 induced ARDS. Lowering systolic blood pressure targets down to 110 or less than 130 mm substantially reduce cardiovascular adverse events in the STEP randomized trial. Among some 8,500 people aged between 60 to 80 in China, the intensive target trimmed 26% of all composite cardiovascular risk. Findings from it now, a second major trial supporting a lower target, could unite the guidelines, which even among the US professional societies ranges the threshold of 130 to 150. With regard to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressures, in 2018, European guidelines on the management of arterial hypertension recommended that diagnosis of hypertension should not only depend on the office BP, but also out of office measurements such as ambulatory blood pressure management or home blood pressure monitoring. And 24 hours nighttime blood pressure measurement were associated with greater risk of mortality and composite of CV outcomes. Thus, they may be considered as the most relevant measurements for estimating cardiovascular risk. For every 20 by 10, that is 10 T systolic and 10 diastolic pressure increment in blood pressure at night, the risk of mortality increases by 23% and the risk of cardiovascular events by 36%. Most patients with hypertension require lifelong medical therapy to achieve optimal BP control. In 2018, European guidelines equally recommended 5 classes of antihypertensive drugs. Considering non-adherence treatment, the importance of combination treatment is also been highlighted to improve adherence to therapy in blood pressure control. So, in context of blood pressure targets, the start of antihypertensive therapies with an initial dual fixed dose combination of ACE ARB or plus calcium channel blockers or diuretic. The reason to detect a known carcinogen, namely NDMA, which can be found in candesartan, irbesartan, losartan, olmesartan, valsartan, they are classified by WHO and Agency of Research on Cancer and Carcinogenic Humans. If 100,000 patients would have received NDMA contaminated valsartan every day for 6 years, the highest dose could result in 22 additional liver cancers over a lifetime of these patients. The presence of NDMA in these drugs could lead to 8 additional cancer cases in 1 lakh population patients if they had taken the highest daily dose of 4, accompanied by significant increase in the rate of emergency department visits of plus 6%. And the most important aspect is that when you find a hypertensive patient, please start according to the guidelines, whether the patient is class 1, class 2, class 3. Choose the antihypertensive wisely and target the blood pressure to be controlled within 130 by 80 diastolic. So that will always reduce the risk of cardiovascular disease by 38% and strokes by 22%. I hope I have cleared many doubts today, and I wish to thank you all for patient listening. Good day.